daily tips for looking after your skin. Hello and welcome to the channel. Commenter Myth Small responded to the video Leprosy is Back with a request. Can you do a follow-up video on the best ways to protect your skin daily? My response: yes, of course. Your wish is my command. I would start off by saying that the best way to approach this type of question is to see the skin as an integral part of the body, the holistic approach. Our skin tells anyone looking all they need to know about our health. As a doctor, the skin of a patient tells me immediately how I should triage them. The emergency cases almost always have a sallow appearance. I call that the death look. The skin is pale, often with a yellowy tinge to it. Fingers are blue even in summer, and the overall appearance is of absence of life. I see death in the skin long before the patient actually dies. It may be partially intuitive, a sixth sense if you like, which develops after years of practice, but it is often effective because it enables me to act appropriately quickly if indicated. Call an ambulance, get the patient the first aid they need, or in some cases, gently let the patient and their family know that the time is coming soon when they will have to say goodbye to the physical realm. This is of course difficult but necessary because it enables the patient to begin their journey out of this physical world in a peaceful, reflective, and purposeful manner, which later on is very much appreciated by their relatives after they've been through the grieving process. The urgent or acute cases similarly have a dull appearance to the skin color. In contrast to the emergency cases, there's still very much life in the skin. It just needs a boost. Redness, swelling, itching all belong to this category of skin problem. The chronic cases happen because the skin is infused with too much of one thing and not enough of another. Too much fat, for example, in the skin denies the tissues and cells within the skin oxygen and water. As is often the case, the patient is not hydrated enough, giving a dry appearance to the skin, and with this comes the risk of easy fissuring and cracks, leading to sores, infection, ulcers. Combine that with skin that is oily and fatty, and you have the real problem of wounds that take a long time to heal, easily get infected, and risk developing into deep wounds that encroach the bone, the dreaded osteomyelitis, for example. I recognize true good health when I see it. It is not an age thing. A glowing nonagenarian has glowing skin, same as a glowing teenager. A drug-addled, unhealthy skin looks terrible on a young person or on an older person. It's not the age. The reason pregnant women look glowing is that they need to be. This is the time in her life when she needs to be at her healthiest. And this is why the body does all it can to furnish her with the best health possible, whatever the health standpoint she is starting from. And one way that this newfound health is projected is through the skin. With that in mind, let's dive into the measures we can take to better take care of our skin, to maintain good health, and to showcase it to anyone who is watching. My first tip to maintain good health of the skin is rehydrate. Our bodies are 70% water. Skin is the largest organ in the body, serving as a barrier that protects the internal organs from harmful pathogens, chemicals, environmental factors. It also helps regulate body temperature and facilitates sensory functions. The feeling, the sense of touch. As such, maintaining healthy skin is not just important for aesthetic purposes, for beauty, but also for overall well-being. A healthy skin regimen requires attention to various factors, from proper skin health care to a balanced lifestyle. Hydration is one of the more crucial ones. The skin's outermost layer, the stratum corneum, is responsible for locking moisture in and preventing water loss. When the body is well hydrated, the skin retains its elasticity, softness, and a healthy glow. On the other hand, dehydration can cause dryness, flakiness, and an increased appearance of fine lines, wrinkles. To ensure proper hydration, it is recommended to drink at least 8 glasses, about 2 liters of water per day, even more in summer, I would add. However, individual hydration very much depends on factors such as age, activity level, environmental conditions in which you find yourself. In addition to water, consuming hydrating foods such as cucumbers, watermelons, oranges, and other fruits and vegetables can also contribute to skin hydration. Direct moisturization of the skin with moisturizing cream is also essential for keeping the cells of the outermost layer intact and not prone to cracking and wrinkling. This is particularly important in the face for both men and women. The beauty-conscious ladies amongst us already know this rule, I hope. Always moisturize your face before bed. Then when you wake up the next morning, your face is fresh, healthy, well hydrated. With this strategy, you will never need a facelift. You're welcome. Now, depending on which country you live in, there are certain medicalized moisturizing creams if normal shop-bought supermarket hydrating creams are not adequate. In Switzerland, for example, we have, and I'm not by any means advertising particular brands, I just mentioned examples of marks or brands that I know of. A particularly famous one is one called Exipial, another one called Dermamed, and the brand Veleda, which is not really medicalized, but in Switzerland, even doctors prescribe them quite a bit. So, moving on to the next step, follow a balanced diet. Now, this is not only essential for skin, it's of course relevant for the whole body, but I have to say that the skin is absolutely dependent on healthy nutrition for it to exhibit this healthy glow we talk of. Vitamin C, found in citrus fruits, berries, and leafy greens, is essential for collagen production, which helps maintain skin's firmness and elasticity. It also has antioxidant properties, helping to protect the skin from damage caused by free radicals. These are noxious substances that can be excreted in blood in the circulation following damage from whatever source, ultraviolet light, etc. And it's a hallmark of chronic inflammation. We've talked about this in previous videos on this channel. Vitamin E is fat soluble. It's also an antioxidant. It's found usually in nuts, seeds, and vegetable oils. And these help protect the skin from oxidative stress and support the skin's barrier function. So protection against infection, against sun or cold damage. Omega-3 fatty acids present in fatty fish like salmon, also in seeds and nuts, walnuts and flax seeds, for example, help to maintain skin hydration and reduce inflammation. And this, of course, can also protect against conditions like acne or psoriasis. Zinc. Now, zinc is an essential mineral found in nuts and seeds and whole grains that support skin healing particularly. It reduces inflammation also and helps control oil production in the skin, making it beneficial for skin that tends to get affected by acne. So particularly in our younger patients, teenagers, or other groups who have a particularly hormonal bent, so pregnant women, for example, zinc is essential. Now, the next step is one that is particularly important if you live in a hot country in a sunny climate, and that is protect your skin against sun protection, of course. Now, this is not only to prevent skin cancers, but also it is essential to reduce damage to the skin that causes weaknesses in the defense mechanism of the skin. So what I mean by that is to prevent damage to the outermost cells of the skin that protect it from or act as a natural barrier to infections. So in order to do this, we know the score. Seek shade whenever possible. Avoid direct sun exposure during peak hours, typically between 10 a.m. and 4 p.m. and when the sun's rays are at its strongest. Use sunscreen regularly. Basically, avoid strong sunlight, strong ultraviolet radiation regularly. It is important to have some sunlight for vitamin D, but not excessive, and certainly avoid tanning beds because these, of course, emit ultraviolet radiation that can damage the skin and increase the risk of skin cancer. It is important to wear protective clothing. Now, this is usual procedure in certain countries where conditions are hot, windy, and perhaps also sandy in extremes of temperature. So long sleeve shirts, hats, sunglasses, all can provide the additional protection that we need against the sun. There are, of course, special UV protective clothing that is available for enhanced defense if you are so inclined. By incorporating sun protection into your daily routine, if required, if you live in a hot country, you can significantly reduce your risk of sun damage to your skin and maintain healthy and youthful skin. It's important to establish a gentle skincare routine. Now, this is not just for the vain ones among us. This applies to everyone. Cleaning the skin twice a day with a gentle, non-irritating cleanser is a good thing. But in most cases, one could argue that just a shower with a gentle, non-harsh soap, perhaps pH neutral, not too acidic, is enough to cleanse the skin, to remove dirt, oil, and pollutants that can accumulate on your skin throughout the day. Overwashing or using harsh cleansers can actually strip the skin of natural oils, leading to dryness and irritation. So this is best avoided. Exfoliating your skin regularly to remove dead skin cells promotes a smoother and more radiant complexion. But again, use a mild exfoliant with a small non-abrasive particle or a chemical exfoliant which contains alpha hydroxy acids, AHAs, or the beta hydroxy acids, the BHAs. Exfoliation should be done 1 to 2 times a week, typically and not more, depending on your skin type. Moisturizing, of course, should be part of your natural routine for good skin care. It's vital to keep the skin hydrated, maintain its protective barrier. This cannot be stressed enough. Choose a moisturizer that suits your skin type. Lightweight, a little bit for oily skin, richer formulas for more challenging, shall we say, skin, particularly dry skin. Apply it while your skin is still damp for better absorption. And definitely, I repeat, avoid harsh chemicals. For sure, choose skincare products that are free from sulfates, from parabens, these have been found to be carcinogenic, and artificial fragrances. These ingredients can irritate the skin and in fact may trigger allergic reactions. Get enough sleep. Now, this is so important. During sleep, the body repairs damage everywhere, particularly in the skin. The body enters into a repair and regeneration mode. Sleep also helps regulate the production of growth hormones that are vital for skin repair and collagen production. Lack of sleep, well, we all know this, can lead to development of dark circles around the eyes, puffiness, and a dull complexion. Over time, chronic sleep deprivation can contribute to the breakdown of collagen and elastin, which are two important proteins within the skin, leading to premature aging. Most adults should aim for 6 to 9 hours of quality sleep per night. Now, it's often difficult to achieve this. If this can be done at least 2 or 3 times a week, that's perhaps adequate enough to cope with the rigors of our modern lives. Together with the advice to get enough sleep is, of course, the accompanying counsel recommendation to manage stress. This is because stress has a profound effect on the body. We have talked about this in previous videos. For example, the video on broken heart syndrome, Takotsubo cardiomyopathy. Now, stress, of course, negatively impacts skin health as well. Chronic stress leads to the production of cortisol, a hormone that can increase oil production in the skin and trigger inflammation, make the skin boggy with fat cells, and deny the skin cells of water, essential nutrients, and oxygen, worsening skin conditions like acne, eczema, and psoriasis. Avoid smoking and excessive alcohol consumption. These, of course, are noxic or toxic substances that constrict blood vessels, reduce blood flow to the skin, and deprive it of oxygen and essential nutrients. Over time, this can lead to a sallow, dull complexion of the skin, wrinkles, and skin sagging. Regular physical activity, again, repetition, but it's essential to stress. Exercise is not only beneficial for overall health, but specifically for skin health, because physical activity or exercise boosts blood circulation. It enhances delivery of oxygen to the nutrients of the skin, and this happens because of so-called vasodilation of the blood vessels. Now, so they open up and oxygen, nutrients, even more blood flow is directed directly to the skin in all of its layers. It also helps remove toxins from the body through sweat, promoting a clearer complexion. Regular exercise can also reduce stress. So this is where the factors are interplaying with each other, so that one factor helps actually the next factor, and together the cumulative or additive benefit becomes exponential. If one can aim for at least 30 minutes of moderate physical activity most days of the week, again 2 or 3, maybe 4, that's adequate for optimal skin benefit. My last tip in today's video is minimize cold damage. Now, we all know very much so about skin damage due to sunlight, hot weather. But what about cold damage? What do I mean here? I shall tell you. This next section of the video is all about chilblains or perennial. We are, after all, at least in the northern hemisphere, in big bad winter. I would be absolutely negligent in my duty towards you if I didn't talk to you about skincare in winter. It would be remiss of me to produce this video without paying extra attention to damage that can happen to your skin because of the cold, especially if you live in the extreme temperate regions of the northern hemisphere like Alaska, Scandinavia, Siberia, and the Alps of Europe. Perennial is a condition in which the skin reacts abnormally to cold exposure, leading to inflammation of the small blood vessels in the affected areas. This problem is common in the colder climes during the winter months, of course, but especially if the environment is also damp without adequate protection. The disorder is most prevalent in people with poor circulation to begin with, or those who are exposed to prolonged periods of cold weather. How does it present? Well, perennial usually includes some form of redness, swelling, and the development of small itchy or painful lesions on the skin, primarily affecting the fingers, toes, and ears. These lesions may be accompanied by a burning or tingling sensation, and in more severe cases, the skin may develop ulcers, blisters, or necrosis. The skin cells may die. While perennial is typically self-limited, it can cause significant discomfort, of course, and may lead to long-term skin changes in more severe cases. Perennial is more prevalent in women than in men, and particularly in younger age groups, suggesting a potential hormonal influence. In particular, it affects thin young women, usually between the ages of 20 and 40. Genetics plays a part, but it's by no means an established risk factor. Typically, it occurs in patients who have underlying vascular conditions like Raynaud's phenomenon or other disorders affecting circulation, typically autoimmune. They may also occur in smokers, of course, in people who already have a risk factor for narrowed blood vessels. How does perennial come about? Now, this condition is primarily characterized by an exaggerated response of the blood vessels to cold temperatures. The skin's response to cold exposure is to clamp up, to vasoconstrict. But in people with perennial, this vasoconstriction is prolonged and exaggerated, leading to decreased blood flow, especially to the extremities, to the fingers and toes, basically the ends of limbs. The cold-induced vasoconstriction leads to the accumulation of deoxygenated blood, so blood that has less oxygen in it, especially in the smaller vessels of the skin. This causes the blood vessels to become engorged, leading to inflammation, hence the redness and the formation of the characteristic lesions that we typically see in perineum. The inflammation is associated with the activation of various immune cells, causing a whole cascade of events that lead to damage and the development of ulcerations in severe cases. But I hear someone say, isn't this just frostbite? Well, not really. Unlike perineal, frostbite typically results in a more severe and prolonged injury, including numbness and skin discoloration. There is a slight difference in terms of severity and the conditions under which perineal and frostbite occur. There is another differential diagnosis. Now, this is important to rule out just because the treatment is different. Vasculitis caused by an immune response. This requires an immune modulator, so it's useful to know that it's that and not perineal or frostbite. Of course, Raynaud's phenomenon, characterized even by intermittent episodes of vasoconstriction in response to cold, can cause similar symptoms, including color changes in the skin. However, Raynaud's phenomenon usually affects the fingers and toes symmetrically because it's an intrinsic disease and it's not just caused by the external factor of cold. It's typically also not associated with the same degree of inflammation or ulceration seen in perineal. There are, of course, other factors that we use in the differential diagnosing process to rule out such intrinsic maladies. So just to bear in mind, not all cold damage is perineal, basically. How do we treat perineal? Well, the first thing to say is let's prevent it first. Prevention, of course, is better than cure. Now, assuming we've done our best to prevent perineal, but we still get it, well, the treatment is primarily symptomatic. Keeping the affected areas warm, avoiding further exposure to cold is the first step. Now, the rewarming must be gentle because if you rewarm skin in fast, rapid steps, sudden changes of blood flow can occur, which causes something called reperfusion injury. This is to be avoided because it worsens the original problem. So the best way is to do this very slowly in terms of warming up the affected limb, the affected part of the body. Over-the-counter anti-inflammatory medications like ibuprofen or aspirin can also help reduce pain and inflammation, and it's generally enough. One can go further with topical steroids, so creams, for example, pomades. These can also help to reduce the inflammation and alleviate itching, redness, and swelling. In cases where ulcers or blisters develop, wound care is necessary to prevent infection and promote healing. In some cases, actual medications may be necessary. These medications promote vasodilation, the opposite of vasoconstriction. These medications include what we call calcium antagonists, like nifedipine. Now, whichever country you are in. There may be different trade names associated with nifedipine or another medication similar to nifedipine called amlodipine. These can be used to help improve blood flow and reduce the symptoms associated with perineal. But by all means, seek medical help before you touch these medications because they have other effects. For example, they are also anti-blood pressure medications. So not to be used unless your doctor says so. Education and follow-up is important. Often people take trips to mountains, to areas where temperature drops can be sudden. It's always important to seek meteorological advice before taking such a trip, and of course to be in a position to seek help quickly should you need it. Avoiding solo trips in dangerous conditions, having a mobile phone handy, and so on. Adequate skincare is essential if we are to adequately protect our bodies. Now, to take good care of our skin is to send out an army to war on tuk-tuk bicycles whilst the opposing army turns up in an armored tank. Do you have other tips for all-weather skincare that I have left out? Do you care to share them? By all means, tell all. And also, ask all about any medical topic. Go on, ask a doc.